Hi, Mr. Alatorre. This is Megan Davis, and this is my third speech, the informative speech for Limestone College. Good afternoon. Today I would like to talk to you about HIPAA, or the Health Insurance Portability and Accountability Act of 1996. Working for a military insurance company, we deal with words like compliance, privacy, HIPAA quite often, but I have to wonder how much it is that we actually know. Sadly, across the floor, I think it's very little. The purpose of my speech is to give you some basic background information in hopes that you'll walk away with a better understanding. First, in August of 1996, then President Bill Clinton signed into law the HIPAA Act. This was to replace the Federal Privacy Act of 1974, and it was more restrictive and stringent in a way that had never been done in a federal program setting. The HIPAA Privacy Act is broken into two titles. Title I is something that assists us as employees of our company. It is for people who lose their jobs or quit their jobs, and it prevents big corporations from being able to come in and hike your premiums or deny you coverage for any sort of disability or previous medical condition. In layman's terms, it's the 12-month rule where if you get a new job and then you have a pre-existing condition, they can only deny you treatment for that condition for 12 calendar months. Title II is the portion of HIPAA that is somewhat more difficult for us to deal with as employees. Title II is where we have our NPI numbers, the national provider numbers that we're trying to get used to now. It's also an electronic standard of healthcare transmissions and the fines and violation penalties that are in place that we deal with. It also helps patients be involved with medical records and the disclosure of their health information that was once just available to doctors, hospitals, and health carriers. This is to say that it does away with the mentality of, I have a folder in my office and it's full of your information and it belongs to me, and replaces it with, I have a folder in my office that belongs to you, I house it for you, and you get to decide the information that is disclosed. It may not seem that way, but providers and health care providers are covered and helped by HIPAA. Follow me when I say this, because I know it's a source of anxiety for us all. By making us write down our privacy practices and streamlining nationally what HIPAA expects, we're able to better adhere to the responsibilities of our employees, we're able to better train them, and better monitor them on a national standard. This is helpful to providers and insurance carriers because it makes sure that we're protected from the very violations that we're trying not to make. I know that when things come up in changes, we can view them in a negative or in a positive setting. I believe that with HIPAA, it is a positive thing. As patients, it can be more annoying because you have extra forms to fill out, extra boxes to check, and as employees it can be agitating because you're worried about minding your P's and Q's and making sure we don't get the company in trouble. However, it also makes us more responsible for ourselves and for each other, and it educates us as employees and as patients on how exactly the medical system works. I received information from Wikipedia online as well as a call to the Department of Health and Human Services, and got a wealth of information that I didn't bring with me, but I do have, and that is available for all of you to view if you need it. It is on Title I and Title II. In closing, I would like to thank you for your time and request that you also look at HIPAA as a blessing, both as an employee and a patient. Thank you.